Hey, Will Ferris with Myopain and Eureka Seminars. So I wanted to do another video on how I integrate dry needling with directionally preferred exercise for the lumbar spine. So I have a patient that comes in and has a relevant lateral shift or just isn't able to tolerate midline positioning. I find that dry needling can be very effective in order to help get that patient to tolerate moving back into midline or even starting to load the painful side of the lumbar spine in the frontal plane. For cases like these, I always like to make sure that I'm checking the QL and the psoas. The QL is in a perfect position to become guarded or irritated on one or even both sides when you have a patient that's got a relevant lateral shift. And since the psoas sits right in front of the QL, it could have the same relevance. On top of that, you've got the psoas, which has connections to all the intervertebral discs from T12 to L5. And it could respond with hypertonicity and trigger points in response to the discogenic pain, and the hypertonicity could lead to further loads on the painful structures. So needling can easily be done for these muscles with one application, since both sit right next to each other, and all you need to do is just change the needle angle slightly to switch between needling the two. I'll very often find myself needling both sides of the body since the muscles are antagonists to each other in the frontal plane, and then right afterwards I'll find that the patient is able to move back into midline and even begin to do more aggressive shift corrections with substantially less pain that's preventing frontal plane movement.